So what are we going to do with pregnant mothers who are HIV positive? Well, what they've come to find out is if you're HIV positive, you take AZT and you have an elective C-section, you will decrease your vertical transmission to your child. Most infants, because they are sharing blood, infant and mother in the womb, babies will test positive when first born. But after birth, infants receive a daily dose of AZT from birth through 6 weeks. Starts the best at 6 to 12 hours after delivery. The longer you wait, the higher the risk. And they figure the dose based on the gestational age and the weight at birth. So how effective is it? Does anybody know? So another thing, pre-exposure prophylaxis, or PrEP. These are patients that are sexually active and do not want to do anything to reduce their risk. There are people out there that don't care if they, I don't know, if they don't care to contract it, but they're not doing anything about it. So we also tell these patients, take Truvada. Now, I don't know how many patients are doing this, but Truvada contains 2 medications, 1 pill a day, but look at your side effects: diarrhea, nausea, tiredness, headache, dizziness, depression, problem sleeping, abnormal dreams, and rash. Not a lot of fun. So who should be taking this? Well, the CDC, WHO would recommend that this is only for sexual transmission people, not HIV drug users. Anyone who's in an ongoing relationship with an HIV negative, positive, I'm sorry, anybody who's in a relationship with an HIV positive partner, so they're positive and you're not. It also includes anyone who is not in a mutually monogamous relationship with a partner who recently tested HIV negative, or active gay bisexual men, no protection, or active heterosexual man or woman with multiple partners, and this group not using any condoms. So that's what they would like to do. Whether people are going to do that, I don't know. Truvada, basically 1 pill a day. Retail price is 1 month's supply, 30 pills, about $1,300. So post-exposure, PEP, you should start your medications within 72 hours after exposure. So PEP consists of 2 to 3 antiretroviral medications for 28 days. This will cut down acquiring HIV. So end-stage AIDS and death, basically. It's like someone having to go through all the stages of mourning. The patient knows they're going to die. They have to accept it. Death is a part of life. The bad thing about this is they probably will lose their personal control. They want to have dignity. They may want to have peace with their family. They don't want to die alone. A lot of different things that are involved in this. So a big part, that's why they have support groups. So possible issues for the RN taking care of somebody with HIV AIDS. You may be asked to help in a suicide or give information about that. You may be asked to help sort out their values. Are they making the right decision? What would you do? Quality of life. And the other thing is you might be present when the patient dies. So if the patient kills themselves, you may be part of taking care or having to deal with a significant other. You may be asked to ask about suicide and how it fits into a religious belief, maybe your religious belief. So controversy. Here are some recommendations that the CDC would recommend. They have not been implemented. They would like routine HIV screenings in all healthcare settings. Hasn't happened yet. They would like HIV testing for everyone between the age of 13 and 64 with an opt-out option, and you have to give consent. Why do they put 64 on there? What's the big issue with age 64? Earlier treatment. So recommendation, WHO says you should start meds when you are at 500 CD4, not lower. If you are cleaning syringes and you use the same syringe, the best way to cut down on infectious disease are to have a needle exchange program. Not all states and cities have needle exchange. If you are cleaning your own needles and sharing them, 3 basins of water, rinse with liquid diluted bleach, and rinse with water again. So common infections go along with HIV because of the risk factor and sexually transmitted diseases. Lots of patients with HIV are just going to come in contact with these same things. So a lot of HIV patients already have Hep C or and B, they have TB, or they have an STD. That just comes with the territory of being involved in risky behavior. So you may be not only passing on HIV to patients, you're passing on another STD if you're not using protection. The aging face of HIV, one of the most rapidly growing groups of HIV is 50 years and older. These patients don't think of condom use because they can't get pregnant, so why use protection? They also have a higher risk of STDs. Not that they're very high risk, but you've got, alcohol use, unprotected sex. There is IV drug use among 50 years and older. Also, the other factor is postmenopausal women. There's changes in their vagina that cause HIV transmission easier. Patients that are 50 years and older, just because they don't have good immune systems and might have other comorbidities, they're quicker to progress to AIDS. Early symptoms, they may just think that they're depressed, they got thyroid problems, or they're just aging. There are patients out there that some studies show that patients 80 years and older die within a month of diagnosis of HIV positive. So ART versus heart therapy for these patients, the best way to go.